of cases. This is and will continue to put immense pressure on exhausted health workers and health systems on the brink of collapse, and again distributing lives and livelihoods. The pressure on health systems is not only because of new COVID-19 patients requiring hospitalization, but also a large number of health workers are getting sick themselves. The unvaccinated are many times more at risk of dying from either variant. Omicron is moving so quickly. In addition to vaccination, public health social measures are also needed to stem the wave of infection, protect health workers and systems, open up societies, and keep children in school. I welcome innovative solutions to reaching vulnerable communities that have not received vaccination yet, because the primary doses are the most important for people to develop immunity. Bottom-up micro-planning with strong community engagement and mobile vaccination teams, which have been highly effective in ridding most of the world of polio, are another way to get vaccines to the hard-to-reach. WHO will support countries as they look to improve access to COVID-19 tools and catch up with routine immunization. Mental health must also be treated as a core element of our response to and recovery from the COVID-19 pandemic. At the G7 and G20 this year, I challenged leaders to ensure that by the end of this year, countries have vaccinated 40% of their populations and 70% by the middle of 2022. 92 member states out of 194 missed the 40% target. This is due to a combination of limited supply going to low-income countries for most of the year, and then subsequent vaccines arriving close to expiry and without key parts like the syringes. And in the case of about 20 countries, supply chain and distribution issues are also impacting rollouts. 40% was doable. It's not only a moral shame, it costs lives and provided the virus with opportunities to circulate unchecked and mutate. In the year ahead, I call for leaders of government and industry to walk the talk on vaccine equity, both by ensuring consistent supply and helping to get vaccinations actually into people. Vaccine supply, for now at least, is improving, although the emphasis on boosters in rich countries could cause low-income countries to go short again. I call on leaders of rich countries and manufacturers to learn the lessons of Alpha, Beta, Gamma, Delta, and now Omicron, and work together to reach the 70% vaccination coverage. This is the time to rise above short-term nationalism and protect populations and economies against future variants by ending global vaccine inequity. I want governments, industry, and civil society to work with us on a campaign that targets 70% vaccine coverage in every country by the start of July. I also want to ensure COVID-19 care pathways with new treatments are available in every single country, and to ensure people get on treatment at the optimum time. We need to get tests everywhere. Ending health inequity remains the key to ending the pandemic. As this pandemic drags on, it's possible that new variants could evade our countermeasures and become fully resistant to current vaccines or past infection, necessitating vaccine adaptations. The technical advisory groups for virus evolution and on COVID-19 vaccine composition continue to review evidence of the variants and analyze the performance of COVID-19 vaccines against them. Any new vaccine update would potentially mean a new supply shortage. So it's important that we focus on building up local manufacturing supply to help end this pandemic and prepare for future ones. One way to increase production of life-saving tools is to pool technology. WHO's mRNA technology transfer hubs are moving ahead in developing an mRNA vaccine. Recently, the COVID-19 Technology Access Pool and the Medicines Patent Pool finalized their first licensing agreement with the Spanish National Research Council for a serological antibody test. I hope there are many more breakthroughs like this in 2022, including for vaccines and treatments. Sharing technology and know-how, as well as waiving the intellectual property rights around COVID-19 tools, should have happened early on in the pandemic. But it's never too late to come together to do the right thing. In 2022, WHO will work with our member states to build well-financed health systems, strengthen preparedness, and ensure the equitable distribution of health tools. From the new WHO BioHub system, which offers a reliable, safe, and transparent mechanism for WHO's 194 member states to voluntarily share novel biological materials, to the new WHO Hub for Pandemic and Epidemic Intelligence based in Berlin, WHO will build mechanisms to enhance partnership. In this vein, the development of a new binding accord between nations on pandemic prevention, preparedness, and response will be a key pillar. I hope to see negotiations move swiftly and leaders to act with ambition. This is the moment for leaders to banish the politics of populism and self-interest, which are derailing the COVID-19 response and threaten to undermine the response to the inevitable next disease X. While 2021 has been hard, I ask everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% by the middle of 2022. We have 185 days to the finish line of achieving 70% by the start of July 2022. And the clock starts now. If we drive this campaign together, we will all be in a much better place by this time next year. Happy New Year. And Tariq,